Great, that's my cue. Well, good afternoon, everybody. Welcome to the Benton-Franklin Health District regular meeting. Today's January 21st, 2026. Looks like we do have a quorum. My name is Carol Moser. I'm the acting chair. Today it's my honor that I was voted as vice chair at the last meeting, and we will go ahead and get started with the agenda. Our first item is the approval of the December 10th, 2025 board meeting minutes.
I move that we approve the December 10th, 2025 regular board of health meeting.
Bondi's moved to approve. Do we have a second?
Second.
Great. Thank you, Marcy. We have a motion and a second to move the board meeting minutes of December. All those in favor say aye.
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 Opposed? That motion carries. Thank you. We now have public comment. Public comment is available here. If you have anybody in the room that has public comment or public comment from the phone. Do we have anybody on the phone that wants to?
If you're on the Zoom app, you can raise your hand to indicate you would like to make a public comment, or if you're on a phone, you can press *9 to raise your hand now.
Hearing no public comment or not seeing any hands raised.
Is that a chat item there? That's public.
Oh, that's just you telling me wait room would start in a few minutes.
I do have a public comment. I don't know if I need to go up there, but I've been approached by several neighbors. We're seeing rats in our neighborhood. And I don't know if that is a public health issue, what public health is doing. Is there any information that we need to get out, which is very concerning to our neighborhood. In fact, they have flyers out now, and I saw one scurrying past my window the other day, and I just freaked out. So
that's me.
Is that you?
Karen, do you want to?
Yeah, you go ahead.
Offline, or do you want me to talk?
No, you go ahead now.
Yeah, actually, we have heard over about the last year, we've received quite a few complaints from citizens around the community around rats. So we're aware that we have an increasing issue. We actually sent our land use supervisor a few months ago up to Seattle to a rat academy course to start learning on how to deal with it here on the east side, because it's not a predominantly east side issue. We do have, I'd say, for additional feedback as well, we do have an environmental health assessment survey coming up where we're hoping to survey the community about environmental health concerns in their neighborhood. So encourage people to fill that out.
Right.
And call us and give us specific location details. And at this point, we're advising homeowners on how to deal with it within their own property. We don't have a program or ability to respond like a King County would.
Right.
But we're here for education and support on pests on your property.
Thanks.
Just quickly, it's not an isolated problem. I participate in a lot of blogs online, and it started in North Richland, spreading into South Richland, and fast. Like everybody's complaining about it, so it's going from one neighborhood to the other. So it's becoming a very common problem.
When does it reach the elevation of public health involvement then?
Well, I don't know the answer to that. We are involved. We're involved, I think, to the level that our capacity allows right now, which is we don't have any specific authority, so to speak, over a private property until there is a specific nuisance or a concern about illness or disease being spread from the issue. So we have to start with a case-by-case evaluation. Call us, we can come out, we can take a look at the issue. And if it looks to be a specific neighbor maybe isn't taking care of some of the issues on their property, we have enforcement tools that we can work with local code enforcement to compel some action there for the neighborhood.
I was just thinking maybe Facebook posts on what to do, what to look out for. We knew what to do because we got a flyer that was in our neighborhood newsletter. So we knew what kind it was. We knew that we weren't the issue because we didn't have any food left out. All of our brush is, away from our house. So we're trying to be very proactive, but I didn't know if the health department was putting out any posts like that to the general public on what to do, because it's just unusual to see that.
Yeah, we pretty regularly do pest posts for specific sectors, restaurants, schools, etc. But I think that's a really great idea. We can take back to comms and get a little bit more messaging out around private, properties and neighborhoods as well.
Do you know what kind of programs they have on the west side?
I'm aware that King County they have a dedicated department in their public health department just dedicated to rats. Honestly, I don't know the depth of what that looks like, but because of the complexities of their rodent issues over there, they have people who dedicate their time to responding to these concerns.
Is there a possibility that maybe we get a 5-minute presentation of whoever you said went, just give us 20,000 elevation kind of, hey, this is the problem, this is how they deal with it over there, this is, level of Department of Health involvement, just so that we can be educated about what could be done, because I see the way it's happening, it will become a problem very soon.
Thank you, staff.
Thank you.
Any other public comments? Director's comments. This is staff director's comments. Okay, none? All right, moving right along. We have unfinished business, the unpermitted food vendors update. Let's talk at 8.
I guess I'll go to the podium. So, all right. Hello, everyone. Erin Hockaday, the Director for Surveillance and Investigation, getting used to my new title. Just want to bring a really brief update on the unpermitted food vendor activity. Since we've talked the last few times, we are seeing in our food safety department, we haven't seen any of these complaints since about mid-December. That's pretty consistent with what we're hearing from across the state. We're hearing from kind of the rumor mill through the vendors that they are not operating due to the weather across the state. So we don't think that this is a matter of them actually leaving our area, but the activity has tamped down due to the weather. We did hear through a state task force meeting where we are collaborating with other local health jurisdictions from one of our larger health jurisdictions in the state that meets with other large cities across the nation, that the city of Los Angeles had this vendor tell them they're planning to send 50 more carts to Washington in early spring. And so we can expect a little bit of a resurgence because Washington is so lucrative for them. So we have here at the local level pulled together a local task force with the help of some of our local police chiefs. We're helping to pull a group together of law enforcement, public health, prosecution staff. So pulling the attorneys and the law enforcement and public health together to talk about this as a collective issue and to talk about it as a Tri-Cities and Benton-Franklin issue, not just a city by city approach. So the intent of that group and the objectives of that group over the winter are really to evaluate our local codes, our municipal codes, to ensure that they're strong, they're in place in terms of what's happening here and enforcement for businesses, specifically food businesses operating without permits. So making sure that we can do an evaluation that those codes are as consistent as possible, knowing we're never going to get to perfect consistency, that our enforcement approaches are as consistent as possible. What we're doing in Pasco with Pasco PD is similar to what we're doing in Kennewick and Richland and so forth. The police chiefs involved in that group have expressed a strong desire for that consistency so that they are not just flushing the problem from one jurisdiction to another. So we've seen really good uptake and really great collaboration with all the agencies involved, and we're happy to see that movement going forward. Our PAO, so Amanda, her team will be participating in a state PIO meeting soon that's going to be convened around this issue. Following that, they'll be bringing back some information, hopefully to our local PIOs here, not just us, but all of the law enforcement PIOs, city PIOs, so we can begin a little bit of a local campaign around the issue as well. Lastly, just developing those consistent communication strategies and a consistent enforcement approach over the winter, so that come mid-February, March, when we think these vendors will start coming back, that we have a plan in place for how we will communicate to law enforcement and how they'll support enforcement. And then on the back end, those attorneys are looking at the codes. So questions, any feedback from the board? Okay.
Are the food vendors required to get a peddler's license?
I think that depends on the municipality they're operating in. So that's one of the aims of this group that we pulled together is to really have the city attorneys looking at their codes to make sure that their code supports the enforcement that they need to do in this as well. Because what we are finding, Commissioner Mullen, is that in some jurisdictions, it may explicitly state in their code that you need to get a permit from the health district and a certain type of business license, whereas cross the line into another city and their code might not support that. So that's something that the attorneys are getting together on the side to evaluate if there's value in having a more consistent approach there.
Good, because I feel, they're competing against our local restaurants and not buying the permits or following the same safety regulations as everybody else.
Yeah, agree. And that's one of our big concerns. That's one of the concerns that a lot of our business owners have brought forward is that this is not just a public health and safety issue, which it definitely is, but it is also undercutting fair competition. We are hearing at that last local task force meeting that we had a representative from the governor's office who showed up and reported that they've now clocked over 65 of these locations across the state. Same vendor. In each area, they were promoting themselves as a small mom and pop, pop-up style family business, which that is not what they are. The governor's office reported at that meeting that they're at most of their locations making sometimes between $2,000 and $3,000 a day. This is a multi-million-dollar collective enterprise where the owner lives out of state with potential or alleged criminal underpinnings there. And so there's more concern than just the public safety issue. There's a law enforcement issue and a competition issue here too.
So let me ask a question. What's the incentive for them not to get licensed or get licensed?
What's the incentive for them to get licensed or not?
Or not to get licensed?
not to
I mean,
get
they're
licensed.
operating in the dark, right? But they're
Yeah.
making tons of money.
Yes.
If my model is successful, I would get licensed and get over this. So why they're not doing it? That's, I guess, the question.
I think the incentive is the amount of money that they are making and the way that they are in Washington, at least from what they're telling other states, is that it's easy to get around the rules in Washington. So that's where we're at the local level trying to shore up our codes to make sure that law enforcement can help support what public health does. And then the state group we're working with is trying to do the same, having the attorney generals review this, getting potentially state law enforcement agencies involved to kind of put on a statewide push to push them out as well. Because right now, you're right, there is no incentive. It appears there's no incentive because they're not showing interest in getting permitted or licensed.
I guess my question is, maybe I should rephrase the question. Is there a secondary benefit from not being licensed in the sense of not reporting income, et cetera? Because that then gets into the revenue issue, which is tax evasion.
Yes.
And that also could be an avenue where you can involve
Absolutely. And
IRS and others.
Yeah, and at the state level, the state representatives that are putting together that state group are getting all of those entities involved, whether it's L&I because of labor taxes, the IRS kind of entities, human trafficking groups, anything where there may be some involvement to a concern outside of public health. That's where we're trying to promote both here and at the state level, that this is not just a public health issue. There is public health at the core of it, but this is a much more complicated issue that needs collaboration from others.
Sarah, can I add to that, Dr. Kwana, to your point? There is some information that we're not privy to, that law enforcement is privy to, that I think speaks to some of why there isn't motivation. What we've learned from talking with the chiefs is that there is investigations that are ongoing. And since this is crossing state lines, it is working with state patrol and higher federal agencies to address some of those activities that we're not privy to.
I mean, the thing is that we're seeing the shell of it as a public health.
Yeah.
But this could be money laundering, this could be human trafficking, this could be bigger issues. And that's why I'm saying is you need to think about, nobody wants to have, I don't think these guys are thinking about, we don't want to be a public health play. Because if it was easy, but there's something underlying that we need to look into, and that's where we can engage those other entities, including the FBI in those cases.
Yes, that's that is the impetus for why all of these agencies are getting involved. So we realize that the tacos are
Yeah, the show.
the shell.
Exactly. Hard shell.
Yes, yes. Next steps, also Monday, Janae and I will be presenting at the City of Pasco City Council meeting on the issue, just to continue to kind of share information about what public health is doing in these spaces, and hopefully just continue garnering that support from all of the decision makers and people we need on board for the push. So
Dr. Krieger had his hand up.
Dr. Prager?
Yeah, just briefly, I was just going to add too, from a business perspective, if you're not taking some of those precautions that we, make food carts and restaurants do, you can cut costs, right? You can, not store food properly, which costs money. You can not prepare food properly, and that's where we get concerned too. But I think that my guess is that some of the incentive too is that you are saving some money by not following the rules.
It's good that we have a coordinated state approach.
yes, yeah, and great that our partners here locally are participating. I know that's not the case everywhere, and so I'm just really grateful for those local partners who are helping us out here. So thank you.
Thank
Thank you.
you.
Janae? Commissioner Mullen does need to go in about 10 minutes. He's been.
Hey, under new business, Office of the Health Officer update.
Before we do that, since
Oh,
Commissioner
yes.
Mullen says he has to leave.
All right.
Do you want to?
Approve the vouchers? Sure. With Commissioner Mullen having to leave at 2, we'll go ahead and jump to item 9, approval of vouchers. Do we have a motion to approve the vouchers?
I move that the Board of Health approves payment of voucher numbers 10225 through 109-2025 and 2-2026 in the amount of $1,165,154.68.
I'll second that.
Great, thank you, Ms. Mullen. All those in favor say aye.
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 Opposed? That motion carries. The vouchers are approved. Okay. And also, didn't you say, Janae, that we were going to defray the executive session until next month?
Yeah.
Okay, until we have some more members here. All right, so we will go on to new business with our officer update. Dr. Prager.
Yeah, thank you. A good afternoon, a happy new year. Lauren, are you able to pull up my slides, or should I take control?
I don't think I got your slides for the Board of Health, so why don't you go ahead and.
Yes, okay, thanks. Yeah, I'll do it. I sent them a little late. That's on me.
Don't worry.
All right. You all see that? Okay.
Yes.
Okay, great. So yeah, couple things today. We are in the midst of respiratory illness season, especially influenza we're seeing, and I'm just gonna go over the data for that real quick. We've talked about measles in the past. Unfortunately, we are seeing more measles in Washington and having kind of significant exposure. So I want to talk about that briefly as well. And again, as well, just touch on some vaccine recommendations, as things have been a little bit confusing lately, and I just want to touch on that. Hopefully, so I personally, I don't know if my family's had the flu, but I've had 3 sick kids for like a week, very sick, like, fevers and just not feeling good, not eating. I wouldn't be surprised if it was influenza, but we never, we didn't test. But I think I've heard from a lot of other, families in similar situations, just kind of a rough time, especially with kids. Hospital admission wise, this is including all hospitalizations from influenza, RSV, and COVID-19. And it looks like we're this blue line here. It looks like we've, hopefully peaked, although I have some caveats to add to that. So, and even potentially even lower than the last 2 seasons, which would be great. But again, I think it's a little bit too early to say that definitively. And this is partially why. This is our emergency department visits with patients with influenza. So the bold lines, blue is Benton-Franklin, red is Washington State, This is data right here is a little bit noisy. It's going up, it's going down, and we just don't quite know. Across the state, it's kind of plateaued in terms of influenza activity. We are absolutely higher than the state in terms of our emergency room visits for influenza. Um, so, where this goes, it's hard to say. Sometimes we have little dips, and then we see like the last year we had a very similar dip at the same time, and then we, had an even higher peak. So we'll see what happens with influenza. All I can say now is that there is a lot of influenza in the community, and it's being transmitted a lot. RSV, we are the blue line, and I'm taking some. Um, let's see, I'm slightly more optimistic about RSV, especially just looking at the Washington data. We hopefully are having a mild season, and we see a very clear peak in the Washington data. Again, our data numbers are smaller, so it's just going to be a little bit noisier with more jagged peaks and that sort of thing. But not seeing a ton of RSV, especially compared to last year and the year before. I've mentioned this last time, but I didn't show the data, but this is our COVID-19 emergency room visits remaining at a very low level. We had a little small spike in the fall, kind of late summer, but we have not seen much happen over the winter time so far, which is great. That's not true of other parts of the country, so I'm curious if we'll see more activity later, but something we're keeping an eye on with COVID-19. So you may have heard the news is right around New Year's when it was first announced, but uh, in Snohomish County, they had 3 visitors from South Carolina test positive for measles. Those 3 individuals were then linked to 3 local cases. So that was declared an outbreak. An outbreak kind of changes on a definition depending on who you talk to, but generally with measles, it's 3 or more cases due to local spread. So like we've linked cases to one another in the same place. So the original 3 cases wouldn't have necessarily been an outbreak, but it turned into one when spread happened locally. Like I said, this is connected to a large outbreak in South Carolina, which has rapidly expanded the last couple weeks. They were having cases kind of up, October, November, December, and then they've had 435 since January 9th, which is a lot. It's a lot of measles. It's rapidly approaching, the large Texas outbreak. We had over just 2,000 across the country all of last year. So just to give you a idea of the scope compared, and that was the worst year of measles we've had since 1991. So we're not off to a great start in terms of measles cases in the United States. And obviously, we're seeing an impact of that in Washington state as well. The One of the things I want to point out with measles is just that how intense of an investigation it is. Measles is so infectious that, even someone spending a short amount of time in a public location can potentially infect other people. That means a huge amount of resources trying to figure out where those people were when they were infectious, who did they have contacted with, what public locations they may have spent time in. And unfortunately, a lot of times it ends up being like an ER or an urgent care, or in Snohomish County includes a children's dentist office, where people are sick, but they don't know that they have the measles. Sometimes they're not quite caught early on in their illness. So you get a couple like ER visits, and that ends up being a lot of people potentially exposed to measles. I'm going to show this map. I have it here, but it's kind of small. But the State Department of Health has this nice exposure map, and showing kind of where public exposures occurred with measles. This is not like households. It's just like if it's a public location, where an active measles case may have been and the dates. And just kind of not locally, but not that far away either in Kennewick County. They did have exposures at Central Washington University in a couple of the buildings there. So just to point out kind of what it looks like when you look at this map, which you can click when we send the slides out, you can click on that link. This exposure occurred on the 8th between 1 p.m. and 4:50, and we don't actively follow people who may have been in this area, but we ask people to, especially if you're not immune to measles, watch for symptoms if you were in that area at that time and get tested if you end up having symptoms. Be interesting to see what happens with measles, especially in Washington State, but as well as just across the country. I'm pretty concerned, and I think we've definitely done prep work about what we would do if we had local cases. But if it does happen, it's gonna be a big lift for the agency. Okay, that's measles. Last thing, and then I'm gonna be done. There's been changes, especially at the federal level, about what is recommended in terms of vaccines, especially for kids, the past few months. And even I uh, struggle to explain all the different changes that have happened. So to keep things simple, from my perspective, and for BFHG, the American Academy of Pediatrics is kind of our best option, our best choice for vaccine recommendations going forward. They are, almost 70,000 pediatricians across the country. They have always kind of made their own vaccine schedule. And to me, it makes the most sense to kind of use them and to point our public towards them. They have a great website. They have a very clear kind of vaccine schedule that mirrors, what we've had in the past. And so I want to encourage people, who have questions. That is my favorite resource, is the AAP, about, what vaccines make sense and when. And you really just, I think there's been so many questions and lots of, questionable information sometimes about vaccines in the public. I think your provider, your pediatrician, your family doctor is the best person to have those conversations with if someone has questions about vaccines. They are equipped, they deal with those questions all the time. And I generally think, especially if you have a good relationship, if you trust them and you're not sure about something, that's your best source, someone that you can trust that has that experience. Okay, that's my spiel for today. Again, Happy New Year to you all, and happy to answer any questions.
Any questions? Well, thanks, Dr. Piper.
I actually do have a quick question, and I don't know if you know this answer. Do we know what the rate of vaccination in South Carolina versus Washington State for MMR?
That's a great question. I don't, but I can look that up pretty quickly, probably. I wouldn't be surprised if it's slightly lower in South Carolina.
Last I looked at it was about 92% in South Carolina versus 94% in Washington.
Okay.
If I remember correctly, for a medical school to achieve herd immunity, you need about 95%. So the reason I'm bringing this up is, while historically we enjoyed the leverage of herd immunity, I think more and more we need to understand this is not the case anymore. And as a physician, I'm speaking as a physician right now, I would urge everybody to reconsider, because I tell this to my patients, reconsider your vaccination history and any updates you need to do.
Yes.
I'm seeing severe cases these days.
Yeah, I appreciate that. And I completely agree. And I would add too, not only, population wise do we try to reach that kind of herd immunity, but it really is sometimes very localized where, we're talking about a school with very low rates, in the 20s or 30s, or, a community, a large family community that, most of them are not vaccinated. And that's when spread can happen really, really quickly in those pockets. And then, and then it can affect an even greater part of the community as well. So, and that's what we've been seeing, especially the last year in the US.
Thank you.
Anything else, Dr. Kwadi?
That's all.
Okay. Thank you, Dr. Fair.
Thank you.
Strategic plan update.
Lauren, if you'll pull up the slides, and Amanda, if you'll come on up. Okay, so the last update we provided to you all was in May of 2025. So I thought it's a good time to give you guys an update, kick us off in 2026. There's some updates we have on the current plan and then where we're going in the new plan. The template we've got here for you today is the same template we've used in the past. We're just going to provide you guys some verbal updates. At the end, I'll kind of recap where we're going. So with that, we'll get started with, as a reminder, we have 4 priority areas: improving trust, workforce development, organizational structure, and then emerging public health issues. Starting with improving trust, we're always working on all the objectives and the activities that are going on under our strategic plan, but today I just want to highlight some areas that we've been more focused on in the last 6 months, including objective 2, 3, and 4, which is about creating a culture of healthy working relationships, improving internal communications, and improving our engagement with the Board of Health and the agency and staff. So as a quick recap, we've been reinforcing our agency values through all staff meetings, town hall meetings, and then recognition of staff who exemplify the values that we have here at BFHD. We've been integrating values into our performance review discussions, making those connections with the performance and what our values are, and then also looking at our guidance documents. Where are those values listed outside of on our website? We've got them in our workplace culture documents. Is there any other areas we want to be able to point to of what our standards are? We've also, it's just a small note, and Aaron talked about it earlier. One of the areas that we wanted to align with the state on is titles with our senior managers. It's actually unique to BFHD, where most other public health agencies reference our senior leaders as directors. So no longer do Carla and Aaron have to explain to their peers what their role is. They can reference, I'm the director, and they're speaking with another director. But it's the small things that make life a little bit easier. We've been clarifying chain of command, leadership support, and available resources to help strengthen communication accountability. We've also implemented an anonymous staff feedback opportunity, what we call Ask Senior Staff, which is now going to be Ask Directors. But it's that opportunity for staff to ask anonymously questions or present concerns to the directors group. And then we have the obligation to then respond either through an all-staff meeting or on a blog post to answer their questions. So just another mechanism. And then also reinforcing the pathways to raise concerns to their supervisors, directors, or HR where appropriate. We've also, this is a nod to our last meeting, but we conducted our first annual Board of Health survey. And then Dr. Kwani, I thought you did a really good job of clearly spelling out for staff if they have questions or concerns, they can reach out to you at any time to express that. So again, underscoring that relationship and ability to communicate. And then providing regular updates at all staff meeting on Board of Health activities and decisions. So this is something that I've been doing for the last 1.5 years, is every time we go into a quarterly all staff meeting, I highlight the action that Board of Health has taken or where they've engaged us outside of regular meetings to support the work of public health. So as a nod to you guys, I just want to say thank you to all of you where you've engaged with BFHD and vice versa, where you've given us opportunities to engage. Katie's done a phenomenal job of, even on her off time, coming in to say hello, bring treats and goodies, coming to even our all staff barbecue last year. So every single one of you has showed up for us. I just want to say thank you. And with that, I'll hand it over to Amanda to quickly run down improving public perception and trust.
And thank you, Katie, for bringing me books for Mason. So I kind of thank you for her when she's here next time. Okay, so some of the other things we've been working on, we have a new brand, but what we're doing is we're working on the messaging, and we're also looking at kind of what we need to sunset in terms of materials so that it's not just overwhelming for everyone. So we do have a couple more things that we want to work with Brandcraft on, although I know we're really excited about the colors, really representing local, and also it's very a modern vibe. So I think it'll fit the local roots, but also what we're seeing here today with new innovation. We're also, some of the things that, I've done recently in terms of connecting people with people and looking at strategies is doing a soundbite training. I was able to give a presentation at Wasalfo for the state, and that was an exciting opportunity to hear some more ideas from messaging so that we're all collectively working together, but then bringing that training here as well as what we're working on next. Noelle, our communications coordinator, she's done an incredible job increasing social media awareness on Facebook We're going to continue to promote more on LinkedIn, Instagram, Twitter. Maybe one day we'll have a TikTok. We'll see. Let's get the foundation stuff working first. Also, Noelle and I have been participating in local communication networks. So our PIOs have regional meetings. It's pretty awesome. So that's some of the local law enforcement PIOs, fire, emergency management, our schools. That's kind of what Aaron was alluding to earlier, is that with the unpermitted food vendors, we're going to be able to bring that conversation. So it's not just our PIO group, but it's a bigger, faster majority. So I'm excited for that. And that really keeps us aware. It's amazing how much we're able to help our community by giving them either talking points about that, or whether it's, temporary warming centers. We're just always in constant communication with our local PIOs, which is pretty awesome. They're a fun group. We have communications staff. We've been updating the pictures and the bios on the website. So now, again, the name changes to director. That's been updated. Eric, your bio is now up there with a phenomenal picture. I got to say, shout out to Sandy, our former communications coordinator. She did an incredible job with the headshots of our leadership team. So that's nice to have that, connecting people with people and increasing that leadership presence already. And then we're using social media during their town halls to connect. So that's through live communication, which is pretty awesome. We had some significant group of people that were looking on not only for live on Facebook, but also live on Zoom or Teams, whichever one that we're able to use at that time. So we're answering questions as people are asking them. And I think that's another way that we're starting to continue to engage. We did that through the Lineage Logistics Fire, and we did it through the food vendor town hall as well. And so we're going to continue to improve that, especially working on Spanish speaking opportunities too through some live communication. So that's kind of our next step that we'd like to do. We're doing those Zen City results. Don't worry, Dr. Kwandi, you're on my list to add to the team. So we still have some time, just getting back from maternity leave, need to spend a little bit more time with all of that data. There is a possibility that we can present at NACCHO in the summer. So we're keeping our fingers crossed to start talking about that, but we'll bring more on how we're going to be implementing that. Also had some really great conversations with our performance management team on, making sure that we're looking at quality improvement within communications, which overall helps, that public perception. The more that we can do internally and the more that we can improve our process, the best that we can serve our community. And then looking at some of the final ones, we're establishing that working plan again to implement the Zen City information. And we are working with our elected leaders. This is going to be a fun year. It's going to be a short session. We're already starting to get our feet wet a little bit. We are going to be expanding that public affairs environment here. So we're working on some resources, some training for our representatives who are going to be at the Capitol this year for Ledge Day, February 18th. And we're going to be following a couple different bills, policies. If there's things that you see, let us know. So we're aligning with the unification message of SALFO and Department of Health, really looking at the FPHS funding, but also figuring out what are some of the things that are working locally that would benefit us. I know one is definitely with our environmental health team, so I'm excited to share more as we kind of get the bill number for that. And those are some of the main updates. Again, we'll continue to try to improve our website. I do think that eventually that focus group of individuals of trying to make sure that it's easy for people to navigate. So we're constantly always working on different things when issues come up with staff on how to better guide our public. So at least that is hopefully helpful as we continue to navigate all the back end. Those are my updates.
Yeah, next slide should be for priority workforce, Brandy.
And I had to throw Moana. Is it?
Thank you. Our Brandy McNeil, that's our director. So our second priority is a workforce for BFHD, and it's a very important resource for us to have because we can't do all the great things in the community without our wonderful workforce. And so our plan is has always been to develop more of a knowledgeable, skilled, confident workforce. They've always been knowledgeable, skilled, and confident, but we want to make them even more so, and have the leadership team to be able to help them build upon a positive workplace. And so we have been targeting on orientation management and leadership positions, and looking towards succession planning, recruitment, retention strategies, and onboarding processes for vacant positions. But most at the core of what I love the most is really building towards the culture and of a positive, supportive workforce where people know that they can ask questions and get the answers that they need. And so we've done a lot of leadership meetings where we've talked about processes and how we can improve upon policies and evaluations. We have better understanding within our leadership to help and ensure that our staff are feeling supported and heard. As Janae has mentioned, the feedback is a great thing that we've been targeting, and through the new 30, 60, 90-day program for our new employees, we've targeted on the 90-day with HR on how we are doing when we're bringing on staff, just hearing them firsthand for the people who are brought on most recently, and a lot of their feedback that they are providing, we are implementing right away, and we're seeing a lot of positive movement. We still got a lot of room to go, but I'm seeing movement all the time, thanks to our wonderful team in HR. I must say, Raynell Flannery and Shannon Jenkins, their HR generalists, are doing a phenomenal job. They just take it upon themselves to just go ahead and start making the changes as we see them coming. We've also provided more opportunities to connect with for our supervisors and have supervisors, managers, and broader discussions within the leadership team. We did an amazing thing, and we revived the EAC, our Employee Advisory Committee, which is I call it the fun committee, but really they are the culture, with the positivity, the ability to help our employees feel acknowledged and engaged. And so I believe it improves our morale. We've improved our communication and our culture. Thanks to that team. It's a very passionate group of new folks. Pretty much everybody is brand new, and everybody's got a lot of great ideas. We've already done some successful events, and we've got many more coming. Looking forward to that as we continued on through the year. Beyond that, we are trying to identify early, continue to try to develop early opportunities for feedback and improvements within the onboarding, so people feel supported within the first 6 months of their work, and then making sure that they understand who their resources are. So class specs are being looked at and revived, and everybody who's being hired knows more of exactly what they're going to be asked to do and how they're going to be measured and have feedback opportunities. So overall, everybody is getting more and more information through all that continued improvements.
Next slide. So next up, our priority is organization, and Pernell, she's here. Yes, there you go. And I will tag team this one. Pernell, do you want to go first? Sure. Because I know you got to escape.
I don't even know if we're going up to the podium. I'm doing it. Yeah, I'm Pernell Hodges. I'm the performance management manager at the health district here. And I'm just going to give a brief little performance management systems awareness. So over the last year, we both drafted, developed, and approved, and then concluded a performance management and quality improvement plan to help us get off the ground for performance management and quality improvement. Included in that was really engaging the health district in engaging in our performance management system, and namely through the identification of performance measures. These measures would be key indicators or key data points that really help to tell the story of the effectiveness in the work that is being done by the program. Many of our programs already have those and are already reporting them to the funders or to other systems, but we're sort of formalizing that process and really making it more streamlined and hopefully the supports that programs need in order to turn that curve and improve the effectiveness and the efforts that their programs are doing are more supported, and they're not just alone based off of what a federal or a national organization is materials that they're producing to them. So we're working on that performance measure identification to then engage more and more into our performance management system. And then we also had our quality improvement process. So we're further developing our continuous quality improvement within the health district. This last year, we developed tools and training materials that we're distributing across the agency almost as we speak, and working through that and advancing that more and more.
Great. Thank you.
So to add on there in terms of organization, there's some other staff kudos I'd like to give staff to you guys, but just quick shout outs to Lauren, Trini, and Kelly, who've also now become certified public records officers with the state of Washington. So we're really grateful to have their resources here internally on their subject matter. Lauren's been working on implementing a new documents management software with IT support. We've done some large scale digitization of environmental health records to bring us into the modern age. And then we're also moving all of our records offsite into proper record storage facilities. That is not an outdoor backyard storage shed. So that's great protection for our records. And I know these sound like small wins, but they're also bigger wins for the greater purposes of BFHD, I think, in our future. And then we've also reactivated some committees and teams. Purnell mentioned one of them, the Quality Council. We've also got a health equity team. Brandy mentioned the employee advisory committee. We've got our executive committee. All of these things to me are great signs post-COVID that BFHD is moving on and moving forward with public health work. And then we're just reestablishing regular meetings within those structures. On our last slide, slide number 4, priority emerging public health issues. Unfortunately, Heather couldn't be here today, but just wanted to make a nod to you guys. She's talked about this before in terms of her work in One Health is continuing and trying to bring those industries together. And then Erin is doing some really cool work. I don't want to steal your thunder though, Erin, with the environmental health assessment, since you are here. Did you want to speak? Yeah, you can if you want, otherwise.
No, happy to. I'll just do it from here. A couple of the areas on this slide related to environmental health are our environmental risk factors and our local climate health program. You've heard me talk a little bit about the climate program over the last couple of years, that we've consciously made an effort to focus it for now towards harmful algal blooms, because that tends to be one of our more critical issues right now. So huge kudos to Jim Coleman, who's kind of the coordinator of that program. He recently won a research grant from the Department of Ecology to do some research on characterization of different species of algae in the river so we can improve our response. So we're kind of in the research space, as well as getting our local response documented and well defined. So that's up and running. And then with the environmental risk factors, Purnell has presented a few times, quite a few times on the CHIP and the CHA process. And to dovetail into that, we are in the process of trying to put together our first environmental health community assessment. So environmental health has never been a really key focus of that community health assessment process. And with this environmental health assessment, we're working with an outside contractor, Village Reach, to do some surveying of the community, as well as some local environmental health subject matter experts. And so we will be running that through the spring and hope to bring together a process that can ideally eventually link up with our community health assessment process. So I'll probably bring back some more information about that later and promote the survey through that.
So I'd also like to tip my hat to Erin, because her team under her leadership has been so innovative between the expansion of our water lab and new technology that's coming out of there, the work in the algae blooms, as well as the environmental health assessment. They are, in some ways, and I'll get to this in just a moment, they are part of that future of where are we going as a health district. So to see environmental health leading the way, that's not just here locally. They're carving out a path across the state, and that's really cool work that they're doing. So thank you, Erin, and the team there in environmental health. So with that, let's talk about the transition from the old to the new. As a milestone for you guys that are here with us, board members, we started building out this plan in early 2023. The current plan that we have, and we were talking about trust, organization and workforce, and we look where we're at today. It's incredible. It wasn't quite a kind of public health focused strategic plan, but it's where we needed to be. We had no idea what we were going to walk through, but in the end, I think the priorities were important to where we're at today and where we're able to go. And so the strategic planning for the new strategic plan 2026 and beyond started late last year. We actually started at the ground roots with staff and a cross section of leadership. We took out the directors and myself, a little bit of a trust fall, and said, hey guys, what do you think that should look like? They've given us that feedback, and we are working through combing through that feedback to start then the prioritizing, as well as incorporating our own visions. And so some of the things that we're starting to see come out of that are innovation. We're seeing policy development. We're seeing regionalization, quality improvement, some of the things that Pernell just talked about that's on our horizon, as well as the impact of influencing the greater public health system. And so I'm excited for that to come forward this year, as well as just a little caveat, we are going to extend our current strategic plan since we're not quite done yet through June. But that'll also give us a little bit more time to work on some workforce items that didn't quite get finished over in HR in the system. So that's our update, and I call it, this is kind of the way Janae's brain works, but it seems like a monumental task right now to pull public health all the way to New York, right? So I'm like, okay, guys, we're going to fly to Denver. That's our first layover. And what does that look like? So we're going to have a new, shorter strategic plan that's going to conceptually move us forward, because we've laid the foundation over the last couple of years in investing in our staff and a great place to work. So I'm really proud of everything that we've accomplished, and I look forward to being able to recap all of our accomplishments with you guys in the near future.
Thank you.
And kudos to you, Janae, for leading the charge on all of this. You know,
it's been fun. A lot of learning. Yeah.
When I first saw number 4 directors comment, I had to ask Laura, are we talking about the board of directors? And then she explained to me, no, that this is a name change for the staff. So that was fun. But we're still keeping Benton-Franklin Health District as our branding name.
Right.
Absolutely.
Yeah, all right. Absolutely.
So that was in question. So
yeah. Oh, is Commissioner Didier, are you still on? Is he still with us?
Yes, I am.
Hey, Commissioner, as a Franklin County resident, I am looking forward to, in the new strategic plan, bringing the needs of Franklin County and Benton County, for that matter, to the state. I just want you to know that when we're building out public affairs and innovation and needs and working with our leaders, I hope you will see in the coming years our voice get stronger for our community.
That'd be great. Thank you.
Yep.
anything else on the strategic update?
Oh, thank you, Carol.
Okay. We've already approved the vouchers.
Oh, there's one more item C each time.
Oh, yes. What does each EAI stand for?
Erin's got that one for you.
Right, back again. And actually, Janae, what you just said about bringing both Benton and Franklin, updates to the state, it segues well into my quick presentation here. I'm bringing just a kind of year out update from our highly pathogenic avian influenza outbreaks plural, that we had last year. We are now officially about 1 year out from the conclusion of our second outbreak last year. And while this short presentation isn't meant to bring findings, bring data, Dr. Kreger and Heather have done that a few times over the last year. I wanted to bring a really brief recap of some of the additional work that our staff have done and contributed to, both at the state, local, state, and national level now at this point. Really just to highlight that when it comes to our response work, that the work doesn't end when the event ends. And that's often in public health, what happens is we have a massive event, and then there's a lot of work that comes afterwards to make sure that we can either clean up procedures here at the state level and share our experience to inform other things. So over the last year, several of our staff have, for lack of the better term, leveraged the experience to inform policy and systems improvements at the state level, shape statewide guidance, share lessons learned with our peers, and overall just to strengthen future preparedness, both state and nationwide. So I want to highlight 3 projects and also try to consciously highlight the contributors to those projects so we can kind of give kudos there. First is a big one that I hope will impact a lot of other local health jurisdictions in the state, which is a statewide role mapping project that happened following our event. knowing that the HPI event that we had here was so complicated with how many agencies, statewide agencies, local agencies, different health agencies were involved. We realized coming out of it that we really needed to get more clear amongst ourselves on roles and responsibilities for the benefit of the farms and the operators that are enduring these events. So WSDA actually promoted the effort. They led the meetings. The contributors involved WSDA, Department of Health, and BFHD was asked to represent local public health in this project. It was about a year-long project. Heather, Juan, Dr. Krager, I contributed a few times from the environmental health perspective, participated in multiple meetings to map every single role, step, every single responsibility and resource required during a highly pathogenic avian influenza event to clarify expectations across all those agencies. So we hope that the impact is it improves preparedness for our local health partners and just creates clearer roles within our government public health system with that outcome of reducing the burdens on the farms and the agricultural operations that may go through this. The final tool is now live on the WSDA website, so happy to hear that. I reached out to them a couple of weeks ago just to confirm, and it is live, and BFHD, like I said, contributed greatly to that project. Second is a little bit of an update on some solid waste rules. So currently the Department of Ecology has our main solid waste rule open for revision, which includes an organics management section. And because of our event and a lot of the conversations we and myself personally have been having with the Department of Ecology around the composting aspect here, they've elected to directly address that in this version of the rule. We're very, very grateful for that because the current rule doesn't address it. So it's gray, right? It's a gray area where everybody's kind of interpreting, kind of coming at it with their own interpretation. And when there are multiple agencies that are involved in enforcement of solid waste, that can get messy. And often that ends up messy for the producer, for the farm, when we're not clear on our roles and responsibilities. So they are now specifically changing the rules to address that lack of clarity. They're adding specific procedural language to the rule related to composting for mass animal mortality events that are due to disease or die-off. So very happy for that. I have directly provided comment, input, had conversations with the people drafting that section, and been able to provide our perspective from an LHJ perspective to make sure we are also considered in that process in terms of our. So there's some kind of policy change we've utilized this to contribute to. And then at the national level, I wanted to just give a shout out and kudos to one of our epidemiologists. So Brandy Williams, she had not one, but 2 abstracts that were submitted and accepted for presentation at the November 2025 APHA conference in Washington, DC. So Brandy and her supervisor, Angelise, both represented by presenting on our outbreak experiences at that national level conference, sharing that support for preparedness across the country. Sharing their expertise. We just want to kind of give kudos for them helping to advance public health beyond just our jurisdiction, also just for the work and the time it takes to do those presentations. It takes a lot of time away from your core functions to develop the presentations, develop the abstracts, fly to the conference and do all the things. So hugely appreciative for that, and that our staff take those moments to utilize those hard moments and opportunities to promote public health. So again, just highlighting how BFHD always aims to turn these responses into lasting systems change, and just appreciation for our staff that continue to contribute both statewide and nationally.
Awesome. Been busy. Yeah. Hey, announcements. I will have an announcement. I heard from Lauren that this is the time when we get to talk. So Tri-Student of the Year nominations are now out. You guys, with your experience out in the public, you might know somebody that exemplifies service above self. The Tri-Student of the Year is a joint project between the Kiwanis clubs and the Rotary clubs of the Tri-Cities. This is our 54th event. We're very excited. We have a great keynote speaker. His name is David Lamott. He's from South Carolina. but he presented at the International Conference of Rotary last summer, and I got to hear him speak, and he is an amazing speaker. He's a Rotary Peace Fellow. So he kind of challenges the notion of individual heroes changing the world. He said the bad news is it's committees that change the world. But he's very entertaining. He'll be a great speaker. Our MC is Peggy Vasquez, who's also a local motivational speaker. And then we'll even have Becca Schwann's hip hop team kick everything off. So you're all invited. I'll leave these flyers here, and you can link to the nominations or the sponsorship page of our website. So that's my announcement. Are there any other announcements? Dr. Quandy, any announcements? Any announcements? Okay. All right, so we come to the date of our next meeting, which is February 18th, 2026. And hopefully our regular chair will be back, Commissioner Alvarez. Anything else for the good of the order? Okay, meeting is adjourned. Thank you very much.
You did a wonderful job.
Right along.